First of all, bitch is hungry. That's what we're gonna talk about first. Hola mis coconetes. So today we're gonna talk about sex ed, and I'm covering a few topics all in one. Hopefully you like it. If you're new here, like, share, subscribe, you know the vibes. And let's get started. Let me just talk about real quick. A canker sore is not herpes, okay? I'll explain to you what herpes is later. And again, you can act like you know, but you can wait and also watch to see when I explain it. So, a canker sore, again, is not herpes. It's like a little ulcer in your mouth. I have one right now that's going away, like right here, because I was eating too many hot chips. And I know it gives me little ulcers in my mouth, aka canker sores. But, you know, I wanted to indulge, so I do this every now and then. So, it only happens inside the mouth and, you know, the lip region inside, not outside, nowhere outside. What can cause it is emotional stress, acidic foods, and the spicy stuff. Excuse me! That's reflux coming through. B12, zinc, folate, or iron deficiencies. If you bite your cheek, or like you stab your mouth with a fork by accident. Toothpaste or rinses with sodium lauryl sulfate. It cannot be spread, but it's painful as fuck. So I would not suggest kissing or doing anything with your mouth. And if you do have one, rinse it with warm water and a little bit of salt. Should help a little bit. But if you like me, stay away from spicy foods because, you know, the acid reflux and canker sores is not pleasant. Alright, now we're going to talk about yeast infections. Da-da-da. By the way, yeast infection doesn't make you dirty. I just wanted to say that. Okay. So, fun fact. There is a fungus us humans have called Candida. I said humans. So that means every single human on this planet. Yes, you watching this right now. I'm talking about you, me, your neighbor, your mother, your father, everybody. When your skin is wet, the candida will obviously multiply. And if you guys know, bacteria grows in moist environments, right? So, a candida overgrowth is considered a yeast infection. Having sex with a woman with a yeast infection will give the man one, most likely. Yeast infections can happen in response to another person's genital chemistry and their bacteria. Like, if you having sex with someone and their body chemistry is just like, whoa, foreign object, yeast infection. Again, I'm not saying this is gonna happen every time, but for some people, like, their body's just like, what the fuck is going on? These are very sensitive areas, you feel me? So obviously, like, if your body's rejecting another person's bacteria, it's gonna cause the infection. Oral sex can also cause a yeast infection, so make sure you brush your feet, floss your teeth, whatever. Antibiotics, hormonal changes, and a weak immune system can also cause a yeast infection. Okay, signs and symptoms for men. They will have moist skin on the penis, white substances in the folds, shiny white skin, redness, itching, or burning. You can develop it if you have poor hygiene, are overweight, not circumcised, and have diabetes. For women, irritation, discharge, itchiness, burning when urinating. It can affect 3 out of 4 women. Many experience at least 2 episodes. Discharge will look like cottage cheese. Douching can also cause it. Alright, now let's go into STDs and STIs. So first of all, STD is a sexually transmitted disease. STI is a sexually transmitted infection. Disease, infection, you cure an infection, you know what I'm saying? Diseases, it's just like, you might get lucky, you might not. Okay. HIV, human immunodeficiency virus. Supposedly comes from SIV, which is simian immunodeficiency virus, which some chimpanzees have. Humans that hunted chimpanzees and got in contact with the infected chimpanzee's blood then got HIV. So supposedly that's how it spread to humans. The immunodeficiency virus infects the immune system and destroys its cells and impairs them from doing their job, which is to fight off bacteria and diseases and other things. It can be spread from blood, semen, pre-semen, rectal fluids, vaginal fluids, breast milk, needles, from mother to child in the womb. HIV is not spread by saliva, but if the infected person has a sore or bleeding gums and the blood gets into the non-infected person's mouth, they will also get it. Or if the person's not bleeding and they both have sores, the other person's going to get it. Preventative measures: use condoms, do not share needles. Now there's 3 stages. So there's the acute HIV infection, where they'll feel like they have the flu, and people are often unaware until like 2 to 4 weeks afterwards. Stage 2 is clinical latency, which is HIV inactivity or dormancy. So it's still active, but it reproduces at a slower rate. So the first stage is like, we must infest. The second stage is like, alright, we chilling, you know, we can reproduce every now and then. It's just, you know, we can take it easy. People don't usually have symptoms at this time. Medications can also suppress the virus to keep it in this stage for as long as possible. This stage, without treatment, can last up until 10 years before developing into stage 3, which is AIDS. Those who do not take treatment can last up to 3 years. Symptoms are still flu-like symptoms: swollen lymph nodes, weakness, and weight loss. They'll be very sensitive to people who are sick around them. They're at a higher risk to obtaining other diseases and cancers. Next, we have pelvic inflammatory disease, but antibiotics can cure this. So I find this weird that it's in the STD section. This is an infection of the female reproductive system. Sexually transmitted bacteria spreads from the vagina to the uterus, the fallopian tubes, or the ovaries. What causes it is an untreated STI, multiple sex partners, or the sex partner has sex with multiple people. Douches. How do y'all say that? Douche, douche, potato. Excuse me. IUDs also can cause it. Symptoms are lower abdominal pain, fever, unusual discharge or odor from the vagina, burning sensation when urinating, bleeding between periods. It can be cured. However, if there's any damage done already, the medicine will not reverse that damage. So you might have scarring. Ladies who have had this are at a risk for an ectopic pregnancy, which is a pregnancy outside of the womb, infertility, and long-term pelvic abdominal pain. Now we have chlamydia, which is a bacteria that infects men and women. You could get it from vaginal, anal, and oral sex, not from kissing, sharing food, or drinks. Symptoms are often undetected until a few weeks later. Symptoms for women are inflamed cervix causing extra discharge, pain or burning when urinating, pain during sex, pain in the lower abdomen, bleeding between periods or heavier period, pain, discharge, or bleeding in the anus. For men, there's white cloudy discharge from the penis, pain or burning when urinating, pain or swelling in the testicles, pain, discharge, or bleeding also in the anus. It could also affect your eyes if you touch your hands right after you get busy, so make sure you always, when you're done, wash your hands, wash your parts, then go back and do what you gotta do if you want to continue. Alright, let me eat some more because bitch, I'm hungry. Next we have gonorrhea, also can be cured with antibiotics. So it's a bacteria infection commonly spread through sex. Men and women, it can affect the urethra, rectum, throat, and cervix. At first there's no symptoms, or like no symptoms at all, but should you get symptoms, men will have painful urination, pus-like discharge from the tip, pain and swelling in one testicle. For women, they'll have increased discharge, painful urination, vaginal bleeding between periods, painful intercourse, abdominal pain, or pelvic pain. Next, we have HPV. By the way, do not get this shot. Do not get this shot. Do not get this shot. Research a little more and let me know what you find. Okay, what is it? It's the most common STI. There's over 200 types, and about 40 of them are sexually transmitted. Now, this does not have a cure, so I'm not sure why they call it a STI and not an STD. But, I mean, that's above me. I have no idea. For both parties, it affects the genitals. So, that'll be the vulva, vagina, cervix, rectum, anus, penis, scrotum, mouth, and throat, too. Supposedly, it can go away on its own, but you'll always have it. It'll just be like sleeping. If left untreated, it can cause cervical cancer, anal cancer, oral or throat cancer, vaginal cancer, penile cancer. Symptoms can be genital warts, warts on your hands, bottom of the feet. For men, they'll have warts in their beard possibly, and women will have it possibly in their legs. It can be spread through intercourse, a cut in your skin, or direct contact with a wart. Let's talk about syphilis now. A sore can be firm, round and painless, or open and wet. Let me show you a little picture. I'm sorry. They are extremely contagious to sexual activities. Regardless of whether it heals on its own, you might still have it. So just finish taking the antibiotics or whatever medicine that's given to you until it is 100% gone for good. It comes and goes for 2 years, lasting about 2 to 6 weeks for each episode where you have it. Now, let's dive into herpes. We're gonna end it right now, baby. We're gonna end all the controversy with herpes. Herpes type 1 is also known as oral herpes. These are sores around the mouth and lips. It can be spread by kissing, sharing eating utensils, drinking from the same cup, even breathing in someone's face. Let's say you take a deep breath and that person just happens to breathe on you. That's how it spreads too. Nobody's safe. 65% of Americans have detectable antibodies to herpes type 1. I haven't found a website that says everyone has it, but yeah, I mean, we all have lots of cancers and diseases in our bodies. They're just not active. So this is one of those things. Mouth sores are common in kids from 1 to 2 years of age. As you get older, it'll affect you randomly. Now there's certain triggers: emotional stress, physical stress, illness, UV exposure, aka being in the sun for too damn long, fever, depression, trauma, hormonal changes can all trigger a random outbreak. It's highly contagious via saliva. So you make out with somebody, boom, you just give them herpes. Now it might not be active for that person, it might be dormant. Majority of the population has at least one herpes subtype for adulthood. No evidence that herpes 1 turns into herpes 2, which is genital herpes. Genital herpes, 15.5% of Americans have this. It is only transmitted sexually. You'll get blisters in the genital areas. They'll spread and cluster within 4 to 15 days. Some symptoms are painful urination, vaginal discharge, or swollen lymph nodes. When you first get the virus, you'll feel flu-like symptoms. Now, these flu-like symptoms for all the other STIs and STDs that I mentioned earlier, it was just like your body's fighting mechanism. That's your immune system being put to work. Herpes can spread from kissing your baby on the mouth, your partner. Most people get herpes from someone without sores. So you won't know who you get it from because symptoms can take years to show up or they just don't show up at all. That's why I don't like when people kiss their babies on the mouth, but I'm crazy for mentioning it. I said what I said. Both herpes 1 and 2 can happen in the genitals or oral region. Also, just because you have one does not mean you'll get the other. It is possible to have both due to how contagious it is. And once again, there's no evidence that herpes 1 turns into herpes 2. Alright, lastly, I want to end this off with, I feel like this is a different one. It's a parasite. Trichomoniasis, nicknamed Trish. I heard this like nickname thing going around in college. They was like, oh, Coco, that bitch is a Trish. And I'm like, what the fuck does that mean? It's the most common curable STI with 3.7 million people infected. Only 30% have symptoms. It is a parasite that infects the vulva, vagina, cervix, urethra in men and women. Symptoms for men is itching, irritation, burning when urinating, burning when ejaculating, and discharge from the penis. Women can have burning, itching, redness, soreness, discomfort when urinating, changes in their discharge. So they could have like less than normal, more than normal, strange odor, it'll be too thick or too thin. Women will be at a high risk for HIV or cervical cancer. Isn't it crazy how like one thing is just like, oh, boom, HIV. It's like, what? Huh? What? How the hell? So yeah, it's up to you what you want to do. It's your life. Just be smart, be safe, and just know how certain things can affect you. Make sure you always get tested, and make sure you get the person that you're about to get crazy with tested, or they show you the results or something. Like, just have an agreement. You could wait. Something in the moment and risking a disease or an infection is it worth it? Okay, so with that, I hope you enjoyed, and I'll see you next Tuesday.